So when you see the patient for the first time and Miss Smith has left hip pain, you determine it's her hip. Then what do you do? How do you manage Miss Smith's hip?
So we like to start with conservative management if this is a newer complaint or something where Ms. Smith has not tried treatment first. A lot of the times this will be simple things like Tylenol and anti-inflammatories if the patient can take those medications. Physical therapy can be helpful sometimes in the early stages of arthritis or other hip injuries. And then we can also use other things such as hip injections and some advanced treatments if those things are not working well for the patient.
And if you're doing a hip injection, what's that like? What do you inject and what do you expect from it?
Right. So hip injections can really play an important role for us in, one, trying to give patients pain relief, but also trying to sort out this idea of hip and back pain. We give a hip injection if we feel like the symptoms are more hip related. And the way that we do a hip injection is we'll typically utilize some type of guidance, whether that's ultrasound or a specific kind of x-ray machine called fluoroscopy, and we'll guide the needle down into the hip joint. We'll provide steroid, which helps with longer-term inflammation, and then we'll also typically put some anesthetic medicine there like you'd get lidocaine at the dentist, and that can give a pretty quick response to decrease your pain.
And that numbing medicine plays another role, right? It helps you decide, is it the hip, is it the back?
That's right. And there are times where I tell patients, I'm going to send you for what we'd call a diagnostic and therapeutic injection. And what that means is I'm trying to gather more information and hopefully we can give you some pain relief. If we give you that injection and you get complete relief of that pain, then that really helps us know that this is much more likely coming from your hip and not from your